Do you know the warning signs of a stroke? May is Stroke Awareness Month, and UConn Health is hoping that everyone remembers time is brain, so you need to be fast.
Caitlin Francis shares what to look for. Take a look.
I was having a banner day. I was up at 5. It was a Friday. I was psyched for the weekend.
Ricky Helner is 66 years old, active and healthy. It was like any other day. She got up, went out to her barn to take care of her horses, and went to start her workday from home.
So I had some time. You know, I was working on my laptop and multitasking, knitting. I'm a big knitter. And it got to be close to work time, and I said, well, I better, stop what I'm doing. And all of a sudden, I just stopped. I couldn't knit anymore. I said, oh my gosh, it felt like I had fallen asleep, right? My arm had fallen asleep and my leg. So I got up and I was actually angry at my leg. I was like, what's going on? You wake up.
She didn't think much of the tingling and numbness in her arm or leg until she dropped a glass of water. So she called her husband.
He said, okay, I have a meeting at 11. I'll be home after that. I said, no, I think you better come now.
She then called her primary care doctor, who told her to go straight to the emergency room.
It never would have occurred to me that it was a stroke.
But it was.
It's very peculiar that when you compare with a heart attack, it gives you pain, and pain kind of brings it to your notice. However, the strokes don't hurt. In majority of the time, the stroke patient will not have any pain. Mm-hmm. And if symptoms are minor, like some tingling in the arm, they try to shake it off.
The stroke team at UConn Health says it's so important to know the signs and symptoms of a stroke and get help quickly.
So B is for balance. It's a sudden onset of severe dizziness or instability of gait. E is for eyes. That's a vision change. So blurry vision, double vision, partial or total vision loss in one or both eyes. F is for face. That's kind of like the hallmark sign that everyone thinks of when they think of stroke, where one side of the mouth looks lower than the other. A is for arm. That's one-sided arm and or leg, weakness, numbness, tingling, not being able to move or use your arm like you typically could. S is for speech. So that's slurring of words, having a hard time getting words out or not being able to talk at all. And then kind of the common theme here, T is time. And we say time is brain, activate 911, call right away, because a stroke is a medical emergency.
While Ricky did not call 911, she did have her husband take her to UConn for treatment, and she got there in time to receive clot-busting medication.
Because I knew exactly when it happened at 10 of 10, and I was able to get to the hospital in enough time, they were able to give me the TPA. So because I was within that, I think, 4-hour window, and that really made a difference.
Doctors say the chance of having another stroke in the first month is high, so they work to identify what may have caused it and prevent with medications. Risk factors include things like smoking, blood pressure, diabetes, cholesterol, and heart disease.
Stroke is treatable and stroke is preventable. The best way to prevent a stroke is to know your stroke risk factors. There are some stroke risk factors. There are some stroke risk factors we can't do anything about, like what's our age, because advanced age is a stroke risk factor, or what's our race. We know by studies that African Americans and Latino Americans and Asians have a higher rate of having stroke at a younger age. Not only that, but these populations, when they have a stroke, they don't tend to do as well as the Caucasian population. So there is a racial disparity in the way people will actually recover from a stroke.
But again, time is crucial. Time is brain, and at UConn Health, many patients are able to go home thanks to quick treatment from the stroke team.
So we follow the patients through the care continuum. We make sure that they receive everything that they need, whether it be rehab, new medications, stroke education, and we lead and navigate them through discharge with our stroke navigator through to our stroke clinic to make sure that they also have everything they need after discharge and they're doing well at home.
I've been very fortunate, and all because I was able to receive the TPA. Really, I had a visiting nurse for just a bit. occupational therapy came one day and physical therapy came one day. So I was very fortunate. I didn't have a lot of residual. So it's been just making sure that I keep moving.
Ricky says she's fortunate to have received treatment fast, and now she's advocating for herself and others to pay attention to the signs.
Be mindful, take a pause, right? Certain things we can't control, but there's a lot that we can. And just being more mindful about what it is you're doing or how I feel. Like, I try to really think about that now and take time to do that instead of multitasking, beyond measure.
Really important that you know those signs of
Absolutely.
balance, you feel that tingling. Always call just to be sure. UConn Health holds community education events for stroke patients and caregivers. For more information on the stroke team, visit health.uconn.edu.